A number of the people that I work with that have Parkinson's report to me about fatigue. They're tired, they can't get enough rest, or they're falling asleep during the middle of the day. And there's a lot of reasons why that can happen, and I just wanted to outline a couple of them so you can talk to your doctor. I think many people say, well, I'm feeling sleepy and I don't sleep well and I want my doctor to give me a sleeping pill and then everything will be great. And I want to tell you that's not the way you should go about it. The best thing you can do for your doctor is to collect information throughout the day so that you can help identify what's causing it, because it could be a problem with sleeping at night. It could be a problem related to medication. It could even be an issue related to depression or apathy or something like that. And so I'm not going to prescribe anything here. I'm not a physician. I'm going to say this one more time. You really should talk to your doctor. But the best thing you can do is go in armed with a little bit of information so they can help you figure out what the cause is. Because if they don't really know what the cause is, they're just throwing stuff out there trying to see what sticks. And that's not the best way to work on it. So let's talk about sleep first, and then we'll go into the other areas. At night, when you're sleeping, if you have Parkinson's, if you're like 99% of the people I work with, you wake up a lot. You wake up, you go to bed, no problem. You wake up 3-4 hours later at 2 in the morning and your mind's racing. Or maybe you wake up a couple more times. And that's probably the best reason to maybe look at a medication. But if you're not experiencing that exact problem, or if maybe you're waking up and then you find that you have to go to the bathroom, well, maybe that's what's waking you up and you need to be addressing that. And they call it, if you wake up to go to the bathroom more than twice in a night, that's something that you can actually see a therapist for. You look for an incontinence specialist, usually a physical or an occupational therapist. Another factor is sometimes the medications that you're taking might wear off when in the middle of the night, and that's actually what's going to wake you up. So you'll get into a situation where you'll wake up and you'll feel stiff, and that soreness will actually be what's waking you up. So that's pain. But that pain's probably better addressed by having a medication that lasts longer through the night. Related to that is sometimes I have people who have dystonia, and dystonia feels like a really painful muscle cramp. And a lot of times I see people getting it in the back of their calf muscles or down in their feet, and it's really, when it happens, it's almost like the worst thing in the world. But once you start to control it, it's actually just a cramp. So that's another one that maybe be something for medication, or maybe something that a physical therapist could help you address during the daytime hours to mitigate that at night. And then finally, the one that I think people don't hear enough about is REM sleep behavior disorder. And that's a situation where you start to act out dreams that you're having in real life. And usually the dreams are pretty violent or kind of aggressive, and you end up, you're fighting something off, or you're trying to get rid of something, or you're trying to run away from somebody. And that's something, again, you need to tell your doctor about, because they need to start trying to address it medically. So those are all the sleep ones, and there's probably other factors I'm missing, because again, I'm not a doctor. But I don't want you to go to your doctor and say, well, I just need this, give me some pills or whatever. It's like that's the wrong solution. Another factor could be during the daytime, it could be a medication you're taking. Some of the dopamine agonists are known for making people sleepy, especially at the higher doses, and that's the ropinirole or the Requip or the Pramapaxil or the Mirapax usually. Occasionally I see someone on bromocriptine, but very rarely. And the issue with that, I guess rotigotine, the patch, Nupro would be another one, but I don't think people are having that kind of issue with the rotigotine the way they are with the pills. And the situation with that is that you can really see it probably because you're taking a pill, and then over time, an hour later, a half hour later, you're starting to have these issues with fatigue. I know a whole other class of medications that people take are anticholinergics, and those are used to kind of tamp down the acetylcholine, which is usually associated with the tremor. And I don't see them a lot in older folks, but especially if I was younger onset and I was diagnosed, I would definitely see people taking Artane, trihexyphenidol, or benztropine, cogentin. Again, doctor stuff. Getting above my pay grade here a little bit. My point is that there could be a medication effect. Even some of the beta blockers, if you're taking something for blood pressure, or if you're a younger person taking a beta blocker for tremor. And the issue with that, again, is that those things slow your system down. They're going to make you fatigued. Pain medication is going to slow your system down, going to make you fatigued. And you just need to talk with your doctor, because there'll be very good reasons why you're taking those meds. And you don't necessarily want to change them, but maybe you change the timing, maybe you change the dosage, maybe you split them up, or maybe you find an alternative that you like better. The final factor is depression. and apathy, which I've had one doctor describe to me as depression without the sadness. And we talk a lot of times in literature and in conference about failure to initiate or difficulty getting people to really get out and be active. But that's a big problem, because if you're not active, you're probably going to actually enhance the depressive effects. And although there are medications you can take, and your doctor has probably explored that with you, and I would definitely recommend looking into it, because if you have a problem firing the dopamine, well, you're now going to have a problem firing the serotonin and the norepinephrine and the acetylcholine and all these other problems, because it all relates to itself. But I would actually recommend, if you're experiencing some of the depression, that you also look at your exercise routine. Regular exercise, and I'm talking about vigorous aerobic exercise, not right before you go to bed, but sometime during the day or in the morning, can have a huge impact on your psychological state and also improve your sleep. So I hope I've given you a little bit to run with here. Again, the main thing is to start identifying what kind of problems you're having at night. Are you noticing any symptoms when you take a medication? Because then you can go to your doctor with something to really solve. It kind of harkens back to when I was first a clinician, and the first thing you do when you see something you haven't done before, you start throwing everything you got at it and see what works. But at some point, you grow into a clinician that says, the problem's here, it's caused by this is how we solve it. And that's kind of what you're hiring us for. So I want you to give your doctor a little bit something to work with, so that they're not having to shoot in the dark. Okay, don't hesitate to contact me. Give me an email, send me a quick message, and I'll answer any more questions along these lines. And in the meantime, good luck and keep exercising.